Hi, I'm Dr. Pawan Singhal. I'm professor with ENT and Head and Neck Surgery Department there at SMS Medical College, Jaipur. I did my MS from SMS itself. Then I was there in private practice, and now my experience is there for last 15, 16 years. Including my PG, I'm there in ENT for last 19 years. If you talk about microscopes, the most important part in a microscope is obviously optics. What I've seen the difference optics makes. When I used to see people doing ear surgery in private, they used to have all those small microscopes, cheaper variants of different companies. I used to see a lot of residual perforations, a lot of disease left inside. I used to see that maybe they are good surgeons, but somehow the results are not up to the mark. And then when the particular center used to switch over to ZEISS, you could make out a whole difference. 1FC was there, 1FC and even 2 or 3 older models were there for last 10, 15 years. And they are still going on. So it's been 25, 30 years, those microscopes are going on, even at a center like SMS, where we do have 12 PG seats per year. That means we make a department of around 70 people, including SRs and medical officers who are working on those. So hundreds of hands has worked on those microscopes and still they are working. You talk about 1FC, you talk about Pico PMI, you talk about XT 300. All of them, they are being used by multiple hands and no problem so far. Not a single problem. A few problems like maybe the bulb goes off. It is okay, it is replaceable. But the duration of the longevity of the machine, I would always appreciate. What gives us the best feeling to a surgeon is ease of operation, the modality which we are using. And this is what ZEISS gives us.